things are not black and white in this world. There is a lot of grey.
Everyone knows it. No one wants to speak about it. Doctors know it because they're the ones turning the patients down. When you have people jumping and trying to scream for help while they're dying and still watching them walk away knowing that their fate has been sealed, essentially, is really... Oh, sorry.
Regardless of what the motives or the intentions are behind doing the investigation that they've done into him, regardless of those motives, I guess you could say, well, if he's got nothing to hide, then there should be no problems.
It just frustrates me that we're sitting here having to defend them, the daughters of Charlie Teo, you know? Surely there's people out there that just want to just forget the hype and just pay attention to the people that are suffering now. Sorry.
Two of Charlie Teo's 4 daughters, Nikki and Alex, have spoken out for the first time. They're frustrated that their dad is facing the threat of a permanent ban from performing surgery in this country. News.com.au understands that no patient has complained about Professor Teo's treatment. Rather, it's been ordered as assessing his paperwork that has landed him in hot water.
Tell us, what's it like growing up with a dad like Charlie Teo?
Growing up with him was the best because obviously the work demands a lot.
Being around brain cancer so often gives you a perspective that many people don't have, and he's here for a good time, not a long time. That's his kind of motto. And so as little girls, we just had a very, very blessed upbringing.
Every moment outside of work was dedicated to the 4 of us, so we've always been really, really blessed. I mean, he thinks that he's made a lot of sacrifices, but I feel like when I look back at my childhood, it's mainly fun, the exciting. We've been thrust into the world of neurosurgery from the beginning of time, essentially. You know, conferences when we were babies, watching him in theatre when we were like, you know, 8 years old, scrubbed up.
We would travel around the world going to neurosurgical conferences since I was probably 4 years old. And at the time, I didn't quite notice that, you know, there are no other children at these conferences. But now looking back on it and going to conferences myself, I think it would have been actually very bizarre for the neurosurgeon to be bringing his small children along with him. We spent a lot of time in Peru, other parts of South America, Southeast Asia, Africa, and we would go, no technology, no phones, you know, be on the ground, helping patients. We would have to pack up all of our toys at the end of every, you know, year, and those toys we would then donate to the children. And I distinctly remember, you know, the first time we did it feeling like, I don't want to give my toys away. And then as soon as we would get to these third world countries, like the feeling that you get kind of giving is so much better than receiving.
The lessons he taught us, it's always been being a good person, putting other people first, never saying no to helping someone, but then also being like very strong, very independent, very individual, never following the crowd. Like, this is just a small memory, but his screensaver on a laptop would be like a really beautiful resection of a tumour. And it was never like a family photo or like photos of like our dogs or us. It was just like 100% resection, like a really clean tumour. And we've never thought anything weird about that. It's just always been how it's been. He's always combined his 2 worlds of personal and work. He's always brought the patient into our lives. He's always wanted to make sure the patients as well knew that they were part of his family. Very rarely we would know that they were patients. They felt like family friends, spending time at their houses, traveling with them, going to see them overseas, staying at their homes, having lunch with them.
It's a double-edged sword because the relationships that you make with patients are some of the deepest, authentic connections that you can make with someone. You know, I remember the first time one of Dad's patients, who we were really close with, passed away, and he had to come and sit down at the dinner table and tell us. And I think I was only probably 8 at the time, and I couldn't really wrap my head around how is this person not here anymore? And to have that happen to us multiple times in our life and develop strong relationships with people and then for them to die, that's a very unorthodox way of parenting. I'm a parent now, so I don't know if I would put my children through that. But what it has done is given us a completely unique perspective on life that you can't have unless you've been through that.
It's very frowned upon to have that relationship with patients, but like everything else in my dad's life, he's always pushed against the norm, and he's always really, really made it a priority to involve the four of us into their lives, creating that relationship, even though they're suffering with a life-threatening disease. They always felt like maybe coming into our family, they would receive the type of care that they deserved or that they felt that is just what they need in order to have their lives saved.
Professor Teo has been operating overseas on patients from all around the world, including Australia, since tight restrictions placed on his licence effectively stopped him from operating on home soil. Once hailed a hero here for performing surgeries that no one else would dare, the narrative changed overnight when Professor Teo faced scrutiny over 2 cases that had tragic outcomes. He was accused of putting his ego and a hunger for money above all else, something his family and indeed his patients fiercely reject.
Can you remember when all of a sudden his name became more controversial, and how did that affect your everyday life?
Oh yeah, it went from overnight. So he was hailed a hero everywhere we went and in all the media outlets, and everyone wanted to interview him. And then I just think, the hook changed, and one day, bad press maybe 6 or 7 years ago, I just think it gave the media an opportunity to piggyback off the back of the public appreciation of my dad. Knowing that anything about him was getting a lot of traction, the media took an opportunity to jump on that, knowing that the public eye was just so focused on him to begin with. I think it was fueled by a lot of tall poppy, a lot of jealousy. Like if we're all doctors and you all study to save lives, surely the incentive amongst the whole cohort would be the same. It's so gross to think that there's even a possibility that there's an element of jealousy when it comes to other people's lives at stake.
A lot of people don't like the way that he acts and what he says, and because he's not thinking about anything else except what he thinks the patient should know and the patient should be aware of and what's in the best interest of them. And if that offends people, he couldn't care less. If that doesn't toe the party line, he couldn't care less. For me, that's frustrating sometimes because I'm like, just, tighten it up a bit. Like, we can be a little bit more PC, can't we, Dad? He's like, nah, that's not who I am. So I think what I would like to get across is that he definitely has his flaws like every other human, and he's an open book. He calls a spade. He really is completely transparent to a fault.
I know that the doctors have always hated him. I know that the doctors, ever since we were young, my dad would come home and be really distressed about either a patient being mistreated because they went to see my dad, or other doctors making his time at the hospital difficult, or rumours being spread. I know that that conversation's always been there ever since we were kids. But the board of the hospitals that want things to run a certain way, if you're that type of way inclined, and then you see my dad trudging through the hospital in shorts and a singlet, never wearing a suit and tie, having a gumball machine in his office, having bloody 4 kids coming in, hanging out, walking through the wards with him, karaoke with patients, with the whole anaesthetist and the scrubbers, riding a motorbike. It's like, that's not how you picture a doctor. Just giving absolutely no about anything other than just doing a really good job at what he does. Mm-hmm. Like, he's not sitting there being like, oh, I want to save lives, but I've also got to make sure I'm ticking the boxes. Yep. It was always just like, save lives, help people, do what I can. But he's always been so just like, let's all just get along and just forget about the rest. I mean, he's just such a giving human being outside of work. Outside of what you see with the patients, it's like, he's not flashy, doesn't really have nice things. Prior to the dining table arriving, it was a beanbag in the bloody living room, and he's just always been just so easygoing, happy, giving, loving, kind. He wears the same clothes every day. And he doesn't even really drive a car. And he had a Suzuki Vitara for 25 years and he never cared about his appearance and he's always flown economy.
No one will keep you more humble than daughters who, whenever we have a chance, we will bring him straight back down to earth. And I think that you need that, and especially in the industry that he's in. And that's why I think he does come across that he has this bravado, and he does have that bravado. And I think that that confidence is real and it's really important, especially when you're dealing with patients who they are at the end of their road. They have been given no other options. I'm going to back you 100% and I'm going to treat you like I would treat my own child. And so you need to have somewhat of that confidence and that bravado. But when he comes home, let me tell you, we pull him, we rip him to shreds. And I think that's really important for him.
His skill set is far beyond the comprehension of most, doctors in his cohort. He's trained overseas, he's operated overseas, he teaches overseas. So he's passed that knowledge on. He's had a big fulfilling life. He knows who he is to his core, and I don't think anyone will ever change that. And he just won't let anyone change who he is. That has burnt him, it shouldn't, because I feel like everyone should be rallying together to focus on what's important, which is saving the patient. The patient should come first.
I think the way that he operates in the world is incredibly jarring to a lot of people. He doesn't like rules, he doesn't like regulations, he's always been like that. So I can completely understand how that would piss people off, and how someone who's just not willing to conform in society it's hard to deal with someone like that. But we're not talking about someone that's, malicious, hurting people, vindictive, self-interested. We're talking about someone who is making extreme personal and professional sacrifices to treat people in their best interest. He's not telling patients what they should do and shouldn't do. He's saying, I will tell you all your options that I can provide, and I will back you with your decision. He gives the patient the autonomy to make those decisions. Any of his patients will speak, and any of his colleagues that have actually worked with him will tell you that in those consultations, he's empowering the patient to make the decision, and he will support that decision.
There's never been a line in the sand between who he is and who they are. There's just a friend. There's no formalities between him and them. And I think that that's jarring for the bureaucratic side of, the health system, which is really unfortunate. The main goal for every single person in healthcare should be patient first.
You've been brave, and don't worry. All my daughters said to say hello. Everyone's really watching out for you back in Australia. Maddie, you're going to do fine, okay? Do you understand? You're going to do fine. I'll look after you. Okay, let's go.
The health watchdog found Professor Teo guilty of unsatisfactory professional conduct in July 2023. That was after complaints about 2 of his cases. He's been under strict conditions ever since. In mid-April 2026, he exclusively revealed to news.com.au that he arrived home from working abroad to be greeted by auditors scrutinising his files. He believes he is now in hot water for giving medical advice to Australian patients in Australia and for poor record keeping. A permanent ban would mean he could be jailed for even offering medical advice to his own family members.
Who Dad is at his core is a doctor. I mean, he is a fantastic father, he's been a devoted father, but nothing comes above him as a doctor. That is his reason to live. And for any government regulatory body to come in and say, I'm going to take your livelihood from you, I'm going to tell you that you can no longer even give medical advice, that seems extremely draconian to me. I find that really disturbing, not just because of my dad's case, but what other powers do they feel that they have where they can just come in and completely take someone's livelihood away from them? That feels very wrong to me.
It's so devastating, and a lot of it is sad for him, but it's the patients who will suffer as a consequence of this is just the most heartbreaking.
Yeah.
It's not about my dad, really. He's the conduit to start becoming more controlling over what doctors to operate on people. He's just the catalyst now where it's okay, you push against the boundaries, we'll punish you, we're going to use him as like a example, without really looking at the consequences of that, which is people will die, and people have been dying, and patients are dying now. You know, people are going to see my dad, or trying to see my dad, not being able to, trying to go see other doctors, being turned away.
Some terrible reason there is a recurrence of that tumour or the disease or what have you, and you seek out that same doctor that you trusted and you have a relationship with, and you're told, no, you can't, you know, the overseeing body has said that he's no longer able to give you medical advice. I would be pissed. I would be really, really upset. I feel really, really upset for those patients that are in that position right now. And, you know, there are a lot of those patients. This is not just through Dad. Like, we have so many of our friends of friends, people that we know, people that approach us on the street and say, you know, I saw Charlie 10 years ago. I had the best outcome. I've been trying to get in touch with him. I just want to check up, and what do I do? And we're like, we don't, you know, we're kind of in limbo right now. And they're frustrated and they're really upset. What happens if I have a recurrence? Like, who am I going to see? I want to see my doctor. And that would be really scary for those people. And I feel really, I feel deeply, deeply sorry for what they're going through.
We had dinner with someone the other night who fought tooth and nail for her 4-year-old son. And she had doctors close the door on her because my dad operated on her son. And, you know, having a nephew now, and just imagining the pain that people would feel having to go home and call it quits. It's just like, you can't imagine it. And people who right now see things about my dad can't imagine it because they've never seen it. They've never had to witness it. They've never had to sit at the table. They've never had to say goodbye to a patient. They've never had to go to the funeral. They've never had to become close with them, see the family suffer, you suffer. So all these people are just like, they think that these words just mean nothing. But they've never seen it. They've never had to deal with brain cancer firsthand. They've never had to deal with what happens when someone's inflicted with a disease of this kind. You know, it's so unforgiving, it's so cruel, it just affects everyone, it affects kids, it affects older people, it affects mums, sons, fathers. You can't wrap brain cancer in a bow, you know? There's no cure, so it's like, you can't really understand brain cancer until you've been cursed to see it firsthand. Every cancer is horrific, but there's something particularly cruel about brain cancer. It affects the way you speak, the way you think, the way you feel, how you talk, how you walk. And so it's cruel. It's really cruel. And people will do what they can to just give themselves a few extra years of being able to walk and talk and speak and hold the hands of their kids and just do things that people take for granted every day. And if it means having surgery and just being able to experience like the ocean or like the sun for 5 years, like what the
What would you say to the people that maybe are looking at things like the rules, you know, where you say he puts the patients first, they're looking at the other things? What would you say to them?
Just don't lose sight of why you started what you were doing. You became surgeons and you became doctors to help people. Don't lose sight of why you started. And I just think that, I don't know, paying so much attention to how someone speaks or someone acts or someone dresses because it doesn't like fit the tune of like respectable, you know, doctor. It just feels so, I don't even know the word for that. It just feels so fake.
So the actual out-of-cost expenses for the patient from the hospital is significantly cheaper in China. The care that I have witnessed myself going there in China is exemplary. He would prefer to be able to do that on his homegrown soil in a comfortable environment for his patients, not have to take a flight himself, every single time to China to treat patients. It's not ideal for anyone. But if that's the only options that, you know, he and our patients are left with, then I guess that's what's going to happen. But what a bizarre situation to put someone in where they have to say, I could do this if we were in China, but here in Australia, I absolutely cannot do it. In fact, I could do this if we were anywhere else in the world. I would take on this type of surgery, but because we're on Australian soil, I cannot say that I can do it. That's not realistic.
I'm not trying to like blow smoke my dad's ass. Like, if there's anyone that can help with him, it's me and my sisters, but I have seen the quality of his surgery, and he is such a good doctor. He's good with his patients. He has good bedside manner. He knows how to talk eloquently. He knows how to captivate a room, and he's a good teacher, but he's more than anything, he's a good surgeon. And I think that not having the option to have that quality of surgery in Australia is really sad. Why would you take that away from them? Their ability to make a decision on their own. Say, okay, yeah, these are the consequences of brain cancer, but I'm willing to take that risk. I feel like if in my position right now, if I had brain cancer right now, I feel like, well, I know for a fact, I want to go to Europe another time. I want to go hiking one more time. I want to do something I want to try at least to do something that I can do. Even if it means I've got a post-operative deficit, like paralysis in my left arm, or like weakness in my left arm, or paralysis in the face, or slurred speech. I can put my feet in the sand. I can walk my dogs. I can lie in bed and watch some crappy TV show. Like, oh, I want that. But to not have that choice, it feels so like dystopian, you know? What's different to that now?
How do you tell a patient who's sitting in front of you and saying, every other doctor's turned us away and told us to seek palliative care and make, you know, my loved one, my son, my daughter, my husband, my wife, my father, my mother, make them comfortable, you know, this is the end of the road. They've then come to Dad, who, like I said, is indisputably a world expert in this very particular type of subspecialty of neurosurgery. And he says, well, I could do that surgery, but technically I'm not allowed to say that I can do it. I mean, that's just not reasonable, you know, that's not reasonable.
It's a witch hunt to take down one person, even though the patients themselves of that person who's being subjected to the witch hunt is shouting from the rooftops. We want him to be able to operate on me. If I have a recurrence, I need him back. We're getting turned down from all the other neurosurgeons we're going to see. We're going here, we're going there. Everyone's saying no. Horrific. Horrific. How do you face that? He pioneered a lot of what he does now, but it's not unusual to see that brain surgery is done this way globally. So you might say, oh my God, high risk, like he should be banned for doing this. Everywhere else in the world, they're doing it. So China, they're doing it. America, they're doing it. Everywhere in Europe, they're doing it. So everywhere else in every other country will allow the neurosurgeons to do the same exact surgery, the same exact technique that Dad is doing. But here, no. Even if it means the patients will die, no, you can't do it. Like, that's so bizarre. Whoever's in charge, whoever's trying to like push the narrative, do they not want the Australian people to know that outside of the border of Australia, there's neurosurgery being done that my dad does that will save lives that isn't being done here? I don't know. It just seems really crazy.